In terms of transdermal, there are certain things that can affect the skin, and i.e. then the delivery of various oils. Do you want to name a few?
So the oils themselves are dependent upon the skin being warm to go in, and that's because the skin lipids freeze at about 16 degrees, so it's very hard to get anything in. Also, the composition of the fats in your skin depends a bit on your diet. And so we have had some instances of people who are on strange diets where they seem to need more material than others. Now, we haven't done a time course in them as far as it goes in, as far as time to go in, but it seems that there's something that's going on there. We have changed the formulation slightly now, and we're just waiting to scale it up. And in those people, it seems to go in better. So it was changing the oils. So then it's the actives. The question I think is you're trying to ask, and that is that iodine can obviously be converted, or iodide can be converted to iodine by an acid environment. And so then the thing that your thyroid takes up is iodide. It's not iodine. Sulfite and molybdate both are bound to calcium and magnesium. And also, if you have vitamin C, it changes them so they become reduced. And you can see this in a test tube when you add it and you have a clear solution, and over time it precipitates. So this material precipitates and it's useless. So a lot of, I don't know how many people, because I don't do the survey of women cosmetics and what they put on their children, etc. But a lot of cosmetics have got antioxidants in them. So antioxidants are reducing agents, so they will reduce sulfite or reduce molybdate, so they're inactive. A lot of them have vitamin C, and it's supposed to be good for the skin. There's this fabled belief that you can get vitamin C through the skin in water, so and that will affect it. So we generally don't recommend using anything but plain soap, and don't use these fancy cosmetics with all the antioxidants and everything in them.
And on the soap front, and obviously the water that people are showering in, bathing, it varies globally, I think. In London, we have huge fluoride content in our water, which will obviously be detrimental to the uptake of the oils.
It won't affect the uptake of the oils, but if you have a lot of fluoride, it can complete with iodide for transport into the thyroid. So that's an issue. The biggest issue is probably the hardness of the water. I mean, we're lucky enough to live in Sydney, and the water's quite soft. And if you boil a kettle, you don't get a ring of white. I lived in Madison, and if you boil water in the same pan for more than a week, you always got a white scum that's in it. So you obviously have very hard water with lots of calcium in it. So in that instance, that calcium can affect sulfite or molybdate because it binds to it and makes it insoluble. So there is a slight issue with that. The other issue we've had with things like improving the hair metal analysis is some people have quite a bit of arsenic in their groundwater. So this has been an issue as well. You see their hair metal is quite high in arsenic. Another issue is with people who are on the gluten-free diet is if you go to rice is quite high in arsenic and lead, which is quite curious if you believe that heavy metal toxicity causes autism, and why you would possibly put a child on a diet that was full of things that could possibly cause autism if they had autism.
Okay, on this kind of side of things, one thing from our own experience and speaking to a lot of other parents is the effect that chlorinated water can also have on iodine specifically.
Yeah, so that's curious, isn't it? Because so many people have filtered water now, and filtered water, the issue won't be there. And it's a question of dose, really. So if you're drinking a couple of litres of tap water a day, it's probably going to have a problem if it's got enough chlorine or fluoride in. If you're only having enough to clean your teeth, it won't. If you are boiling your water and making tea out of it, it might be an English thing that you might do. We do it here as well. Then the chlorine and the fluoride will go off when you're boiling it, so that's not so much of an issue. But you have sodium chloride floating around in your body, obviously, so it's not that much of an issue with the thyroid. So yeah, these are caveats. and they're in the literature.